So I'm talking this afternoon with Paul Nixon, Chief Social Worker in New Zealand, who's working with the Trust for a few days this week, helping us to get closer to what we think we mean when we talk about relational practice, restorative practice, working with families in a new and different way, because it's something the Trust's really keen on seeing come into fruition. So Paul, thank you for joining us for this. If the Trust wants to encourage practitioners, social workers, family support workers, to work in a way that is really relationship based and really restorative in its nature, what do we need to provide for our staff, for our colleagues out there doing the hard yards, to make it easier for them to do it in this way?
So we need to think about how we free practitioners up to focus their energy and time on engaging with families and positioning family to take control over the key decisions affecting their children. That means supporting and training practitioners in engagement skills and collaborative skills and restorative practice processes that allow them to do that really effectively. It means deconstructing some of the things that get in the way of that relational practice. So if you have systems or processes that are corrosive on the relationships between families and professionals, we need to look at those and think about taking some of those out. We need to think about how we build more trust in the relationship we have with families, and by doing that, giving them more control means giving social workers more freedom to negotiate with families how things are done. So for social workers' experiences to be empowered in their work, they're more able to hand that on to families who they work with.
So how do we equip then our team managers and our heads of service? How do we enable everybody to experience an environment where those permissions are in place?
I think it has to run, it's a great question. I think it has to run through the whole organisation. So people need to see managers and leaders behaving in those ways, creating the space for people to lead, creating the space for people to negotiate with families about what they need. It means rethinking some of our old ways of doing things to people or taking responsibility off people, and thinking more deeply and more broadly about children's connections with their family and community and how we strengthen those. So that means sharing decision making much more with people, giving them information and resources to make decisions, and then honouring their decisions when they've made them and following through on them.
So there have been times in our short careers where this way of working has sometimes been criticised as in some way denying danger. Somehow this kind of idea of bad apples never falling far from the tree, and why is it safe to invest in family as decision makers if we're talking about a child who might have been harmed by a member of their family?
So a child's rarely harmed by a whole family. It's usually one individual or a couple of individuals in a family. Once you start widening the circle of people who can offer help and support, you're bringing in people who are not in crisis or not in difficulty, who have an existing connection with the child. And what research is showing us is that when people have healthy or existing relationships with children, our practice should seek to strengthen those connections, not diminish them. So yes, families or members of families can cause harm to children, but equally, probably more importantly, wider families can protect children if they're positioned in the right places. So our work is to make sure that the strengths around the children are enhanced, therefore the safety is enhanced.